Welcome to the Access California Shared Power and Collaborative Decision-Making e-learning module. Just a brief background on Access before we jump into the material. Access California, a program of NorCal MHA, is a consumer-led stakeholder advocacy program funded by the California Mental Health Services Act and the Mental Health Services Oversight and Accountability Commission. NorCal MHA was founded in 1946 and is the oldest continuously operated consumer advocacy agency in California. NorCal MHA is a peer-run organization that specifically hires people with lived experience. So what is Access? Access stands for Advancing Client and Community Empowerment through Sustainable Solutions. Here's a quick video that sums up what we do here at Access.
If you live in California and are familiar with public mental health services, it's important that you get to know us. We're Access California, a program of NorCal MHA. We are the statewide consumer advocacy program funded by the Mental Health Services Oversight and Accountability Commission and Prop 63, the Mental Health Services Act. Whether you're an individual who is receiving services or has received services in the past, you work for an agency providing these services, or you are a county-run behavioral health system, we are here to support you. Access California stands for Advancing Client and Community Empowerment through Sustainable Solutions, but you can call us Access for short. Empowerment through sustainable solutions? That's a big task. It requires research, understanding the current system and challenges, including policy and legislation. Outreach, raising awareness, and getting statewide buy-in at all levels of the system, and maintaining a statewide network of advocates. Advocacy, turning that awareness into action, being proactive and practical about what can be done differently, and challenging suboptimal practices. Education, mentoring and creating leaders, sharing knowledge about recovery, peer support, the stakeholder process, and best practices across the state by providing technical assistance for counties and providers. Although a big task, NorCal MHA has been a leader in consumer advocacy in California for over 70 years. Access California is ready for the challenge. Learn more about Access California or how to get involved on our website, www.accesscalifornia.org, or call our Ombudsman and Advocacy Helpline, 707-572-HELP. That is 707-57.
At Access, we value advocacy, recovery, and peer support. Now let's spend some time talking about what that means. In terms of advocacy, we are striving for meaningful stakeholder participation, active solicitation of community feedback, expanded opportunities for stakeholder involvement, and stakeholder inclusion at all levels, which includes policy development, program planning and implementation, and services delivery, oversight, and administration. With recovery, we're seeking infusion of recovery principles in all aspects of services delivery, which includes client voice and choice, individualized services, shared power and decision-making, and treatment always being voluntary. We advocate for recovery-based training and support for mental health professionals, as well as tracking, reporting, and analysis of recovery outcomes in all mental health programs. Finally, with peer support, Access advocates for fidelity to the evidence-based model, incorporation and expansion of peer support in all mental health programs, and living wages, ongoing professional development, and opportunities for and peer support positions. Reflecting on those values we just discussed, the core of what Access says includes research, advocacy, education, and engagement. We also offer a stakeholder ombudsman and advocacy helpline. Stakeholders can report barriers to participation and perceived violations of the community program planning process, and Access will review the complaint, conduct research, and will initiate a resolution with the local or state mental health agency in question. Additionally, callers can receive help navigating our online, local, or statewide advocacy directories and assistance advocating for mental health needs on the local grassroots level. To reach the Stakeholder Ombudsman and Advocacy Helpline, call 707 572 4357. An easy way to remember this number is 707 572 HELP, HELP. In this training, we will go over a brief overview of the Mental Health Services Act and the Stakeholder Bill of Rights, what shared power and collaborative decision making is, guidelines for shared decision making, barriers to shared decision making in community planning, and outcomes of shared decision making in community planning. Before we jump into shared decision making, let's briefly review the MHSA for context. If you would like a more in-depth training on the MHSA, please see the Access MHSA Basic Training eLearning module. The MHSA, also known as Prop 63, passed November of 2004. In addition to establishing a 1% tax on income over $1 million, the MHSA expanded public mental health care and provided the opportunity to design new or adapt old mental health services. The MHSA also sought to transform the mental health system through expansion of services and improve the continuum and integration of care. Merriam-Webster defines standard as something set up and established by authority as a rule for the measurement of quantity, weight, extent, value, or quality. There's a handout on these attached to this presentation, but for now, just keep in mind that these 6 general standards should be reflected in all the plans as well as with the development of all of the plans. The 6 general standards for the MHSA are community collaboration, cultural competence, client-driven, family-driven, wellness, recovery, and resiliency, and integrated service experience. If you are already familiar with the MHSA, you may have heard of the 5 MHSA components: prevention and early intervention, community services and supports, innovative programs, workforce education and training, and capital facilities and technology. However, there are actually 7 components, the other 2 being prudent reserve and community program planning. For context, let's briefly focus on the community program planning process, or CPP. The CPP is used to develop the 3-year program and expenditure plans and plan updates in partnership with stakeholders to identify community issues related to mental illness, to analyze the mental health needs in the community, and to identify and reevaluate priorities and strategies to meet those needs. Again, please keep in mind that the MHSA is intentionally emphasizing stakeholder partnership throughout this process. It's not enough to just have stakeholders seated at the table. All aspects of the community planning process must be consistent with a recovery vision to promote key concepts: hope, personal empowerment, respect, social connections, self-responsibility, and self-determination. To promote consumer-operated services, peer support programs, and positions. To reflect culture, ethnic, and racial diversity, and to plan for individual needs. Knowing that stakeholders must be involved in all phases of program planning, it is important to understand what rights stakeholders have. The Stakeholder Bill of Rights includes transformation, information, education, representation, participation, and consideration. We will be discussing these in more detail in the following slides. There's also a handout available attached to this presentation. Let's examine these rights a little more closely. Transformation. We have the right to a public mental health system that embraces the recovery model of care and is fully committed to all general standards for programs and services set forth by the MHSA. Information. We have the right to full transparency in our public mental health system. Education. We have the right to fully understand the meaning and implications of facts and data relevant to our public mental health system. Representation. We have the right to competent and adequate representation when important decisions are made in our public mental health system. Participation. We have the right to shape policy and meaningfully participate in all important programming and funding decisions in our public mental health system. And consideration. We have the right to submit grievances to our public mental health system, to have our grievances acknowledged, and to receive thorough and timely responses to our grievances. Now that we have the context, let's dive into what exactly is meant by shared power and collaborative decision making. We'll start with some background on collaborative decision making, which is sometimes also referred to as shared decision making. Despite stakeholder partnership being a requirement of the MHSA, collaborative decision making is frequently missing from community planning in general. Because of this, most definitions of collaborative decision making are rooted in clinical practice. For example, here, collaborative decision making is defined as a process by which clinician and client engage in a two-way communication of information, clarify values and influences regarding a treatment decision, and agree on a plan of action. Now let's think about this outside of clinical practice. Collaboration in general means a process to reach goals that cannot be achieved acting singly or at a minimum cannot be reached as efficiently. What about shared power? Shared power simply means that there is no power differential between the decision makers. Everyone is on a level playing field. That said, collaborative decision making is basically a collaboration with shared power. Everyone is working together to solve a problem, and everyone has equal pull. So, a better definition of what collaborative decision making is a process that supports multiple stakeholders with the development of a vision and long term ambition, and with the translation of that vision and ambition into a specific approach and activities. You can also think of shared power and collaborative decision making as community collaboration. The Welfare and Institutions Code defines community collaboration as a process by which clients and our families receiving services, other community members, agencies, organizations, and businesses work together to share information and resources in order to fulfill a shared vision and goals. In this video, Michelle Gibbings provides more insight into collaborative decision making.
Peter Drucker, one of the fathers of modern management theory, said making good decisions is a crucial skill at every level. Now, in a complex and ever-changing world, the need for leaders to be able to make good decisions is more critical than ever. But what constitutes a good decision really depends on your perspective on the outcome of that decision. And that perspective is often shaped by how the decision is made. So if the process to make the decision is secretive, done in isolation, it can breed distrust and confusion. Whereas if the process is transparent and it involves people, it's much more likely to lead to buy-in and understanding. And that's where collaborative decision-making comes in. So collaborative decision-making, like all forms of decision-making, it's a process. It's really deliberate, though, about who's involved and when they're involved. And that's because it's based on the belief that by involving people in the decision, you're much more likely to get a better solution. It's the whole two heads are better than one, the scenario. You're likely to get greater buy-in to the decision as well. Now, you can never treat decision-making techniques as a one-size-fits-all approach. So different situations require a different decision-making process. There's two things to think about. One, what's the level of buy-in that you need for the decision? Two, and who's got the knowledge that's going to really help you make that decision. So you determine who needs to be involved and when and to what extent they need to be involved. Now, when you make a decision alone and consult no one, you really run the risk of having a disengaged team or stakeholders that don't understand or support the outcome. Plus, as a leader, you're also assuming that you've got all the information that you need. And that's often not the case. Now, such an autocratic approach can be useful, typically in times of a crisis where quick decisions need to be made and you need a really clear chain of command. In those types of situations, it can make sense to have one person making the decision. But that doesn't mean that the person making the decision isn't seeking advice or taking on board the ideas of others. When you're leading a change, though, or trying to solve really complex problems, you're much more likely to get a better outcome if you take a collaborative approach. And a collaborative approach means that you seek input from those around you. And when you do that, you also need to be aware of which ideas you're listening to and which ones you're discarding. Because you can do surface collaboration where it appears like you're getting great involvement, but really you're actually only listening to the louder voices, or you're only listening to the people that you want to hear. The quieter minority is silenced. In other circumstances, you may want to take real collaboration to a high level, to the highest form of collaboration. And in this case, what you're doing is actually seeking consensus, using a process that's going to lead you to consensus decision-making. Now, the problem with the consensus decision-making is it's got almost a bad connotation associated with the word. It invokes images of long debates, watered down outcomes, kind of meaningless results. It's not like that. When you use consensus decision-making well, it's a really, really powerful process for building engaged and connected teams and stakeholders who really buy into the process. Now, consensus doesn't mean that everyone has to agree with every element of the decision, but it is something that everyone is willing to live with. And with a collaborative decision-making process, it ensures that people in the group feel heard. And when people feel heard, they're much more likely to buy into the decision. So it's a facilitated process where you generate ideas, sort them through, clarify that you've understood those ideas. And when you do that, it becomes much easier to then work out where are their common ground and where are their differences. And those differences then become an opportunity to explore the idea from multiple angles. And when you've done that, you've actually got much more comfort that you've explored the idea deeply, you've explored the issue from multiple angles, and you're therefore much more likely to make a better decision.
Now that you understand what is meant by shared power and collaborative decision making, take a few moments to think about how this is reflected in your own community. How are stakeholders currently being utilized in your county's community program planning process? Do stakeholders approve the plans, rubber stamp, or are they involved in developing the plans? Let's move forward with guidelines for shared power and collaborative decision making. Reflect for a moment on your own experiences. Think of a time when you were part of or observed an extraordinary display of cooperation between diverse organizations or groups. What made that cooperation possible? Some of the things that came to your mind are likely on this list, which comes from the Western and Pacific Child Welfare Implementation Center and the Los Angeles Department of Children and Family Services. The guiding principles of stakeholder engagement are inclusiveness and representation, reciprocity and partnership, clear and transparent communication, accountability and follow up, integrity, mutual learning, flexibility and adaptability, and respect and relationship centered. There are a few prerequisites for collaborative decision making to be successful. These include a favorable policy climate, appropriate regulatory, professional, and legal standards, availability of decision support, including information and tools, training for agencies and a guiding body, evidence of efficacy, metrics for monitoring progress, financial and other incentives, and a feasible implementation plan. As we just learned, favorable policy climate and appropriate regulatory standards are prerequisites for successful collaborative decision making. Some relevant codes to keep in mind are the Brown Act and the Bagley-Keene Act. The Brown Act defines meetings as any congregation or teleconferencing of a majority of the members of a local public body with the intention of deliberating public matters. The law also explicitly states that public bodies cannot use communication methods like email to circumvent the Brown Act. Notable exemptions to this definition include the attendance of public conferences whose topic is governmental actions, so long as the members of the public agency do not meet separately but only participate in the conference. Open publicized meetings organized by private individuals to discuss public topics. Purely social or ceremonial events where the board does not separate to privately discuss public matters. Many local jurisdictions, including San Francisco, Contra Costa County, and Oakland, have adopted local sunshine provisions that increase the access and openness to the public. The Brown Act also requires local agencies to post meeting agendas at least 72 hours in advance of any regular meeting, to post notice of continued meetings, to deliver notice of special meetings at least 24 hours in advance to those who request it, to deliver notice of emergency meetings at least 1 hour in advance, and to allow actions on items that have not been agendized only under the following circumstances, such as when a majority vote of the board establishes when an emergency situation, or when two-thirds of the board, or unanimous if two-thirds is not present, decides that there is a need to take immediate action on an item that came to the attention of the board after the agenda was posted, or when an item has been postponed from a previous meeting that occurred not more than 5 days ago. The Brown Act also requires local agencies to notify the media of special or emergency meetings if requested, to allow the media to remain in meetings cleared due to public disturbance, to hold free of charge meetings in places accessible to all, to not require a sign-in for anyone, to allow non-disruptive recording and broadcast of meetings, and to let the public inspect any recording made by the agency of its open meetings. The agency may destroy recordings it made after 30 days. Additionally, the Brown Act requires local agencies to allow the public to address the board at regular committee meetings on any item in the agency's subject matter jurisdiction. The Bagley-Keene Act. This act defines meetings as all meetings of a majority of a state body and designed to deliberate, discuss, or decide on any matters before the public body. The act explicitly states that the use of communication technologies such as email or text messages to arrive at a consensus outside of an open meeting is prohibited. The act does permit teleconferencing, provided that it is conducted in accordance with the act. Notable exceptions to this include university collective bargaining and arbitration meetings with employee unions, public conferences, provided that the members of the public body do not separate to privately discuss governmental matters, open and publicized meetings sponsored by a private individual, and purely social or ceremonial meetings, provided that a majority of members do not separate to discuss public matters. The Welfare and Institution Code also directly addresses meaningful stakeholder involvement. It states counties shall demonstrate a partnership with constituents and stakeholders throughout the process that includes meaningful stakeholder involvement on mental health policy, program planning and implementation, monitoring, quality improvement, evaluation, and budget allocations. It's important to point out that stakeholders are not meant to act as a rubber stamp. For true shared power and collaborative decision making to occur, stakeholders' involvement must be meaningful. Meaningful stakeholder engagement is not just an end in itself, nice to have, or a good way to manage crises. It is an essential and mutually beneficial strategic function that results in better informed and more effective policies, projects, programs, and services. But how do we make that happen? Here's a model to help ensure stakeholders are included in a meaningful way throughout the collaboration process. Plan and design, internal engagement and capacity building, listen and engage, synthesize and strategize, reflect and affirm, finalize strategy, adopt and launch, and evaluate and improve. We're going to go into more detail in the following slides. Phase 1 of this model is plan and design. You'll need to define the purpose of the collaboration and any desired results first thing. To do that, you can ask questions like, what is the problem intended to be solved? Why is stakeholder engagement vital to the solution? What are the desired results, tangible products, and criteria for success for the process? How those changes or products benefit the department and/or others? And how do they relate to the strategic plan objectives? Defining the desired results or the reason for why a stakeholder engagement process should take place is the single most important stage of the process. A strong set of results should be highly focused, while a poorly defined set of results is often vague regarding the intent of the project and often open to different interpretations. You'll also need a work plan. We'll look at sample stakeholder engagement work plan template on the next slide. You'll need to ask questions like, how will stakeholders be engaged? Why would this method work best for the group of stakeholders at this point in the process? Of course, before you can engage stakeholders in a meaningful way, you'll need to identify those stakeholders. Who are the stakeholders that should be included in the effort? What is known about these groups, such as key characteristics, behaviors, values, cultures, and needs? Once you've answered all these questions, you'll want to design and document the process. Here is an example of a stakeholder engagement work plan template. As you identify stakeholders, it's important to remember that stakeholders are not a homogeneous group. Stakeholders are individuals with different backgrounds and motivations. The three main types of stakeholders are internal, external, and key. Internal stakeholders are people who already are committed to the organization as staff, volunteers, executive leadership, and board members. External stakeholders are people who are impacted by an organization's work as service recipients, community members, partners from the public and service sectors, funders, advocacy and interest groups, and others. And key stakeholders. Any stakeholder who is significantly affected by an organization's actions and or has considerable influence on these actions. You should also consider others you will be partnering with, such as community partners and system partners. Community partners are contracted and non-contracted community-based organizations, faith-based groups, associations, etc., that can contribute to creating a community of support. Systems partners are other agencies and organizations that impact the clients. Once you have designed and documented the process thus far, you'll move into phase 2, engagement and capacity building. First, you will identify and engage members of a guiding body, which we will discuss in more detail in the next slides. Then a group charter will need to be created. Some things to consider when creating the group charter include purpose and context. Why was the guiding body formed? What challenge or problem is it trying to solve? How do guiding body goals fit in with the broader objectives of the organization? Desired end result and deliverables. What is the desired outcome of the guiding body activities? What key performance indicators will be used to measure the intended success? Parameters, authority. It is important to specify with which decisions the body has the authority to make and which decisions will be referred to agency leadership or other groups for decisions using the recommendations developed from this body. Decision-making processes. When making decisions and recommendations, it is important to determine how members will make decisions and how they will resolve any conflicts or disagreements. You'll need to identify key characteristics, behaviors, values, cultures, and needs of these groups and use this information to assess and create appropriate trainings, resources, and communication materials. And of course, you will want to document this phase of the process. A guiding body is a group of stakeholders charged with a specific purpose to support the stakeholder engagement process. As you form your guiding body, be sure to reference and incorporate the MHSA general standards we discussed in the beginning of this presentation. Here, we have a few examples of types of guiding bodies that can be created. Guiding bodies are referenced in several stages of the stakeholder engagement process as a vehicle to engage stakeholders in the planning process. These groups are simply teams or committees charged with effectively providing input throughout the process. Regardless of the specific assignment of any one of the guiding bodies, similar characteristics need to be in place for the group to be effective in carrying out their mission. The model for effective guiding bodies is commitment to vision and principles, clear role, authority, and governance, data-driven learning and accountability, relationship-based collaboration, partnership capacity and leveraging resources, and long-term commitment and support from leadership. This model incorporates best practices based on national advisory and guiding body models, as well as successful strategies that were utilized to support DCFS's strategic planning and data-driven decision-making processes. In a review of guiding bodies across the country and within Los Angeles DCFS, the following practices have been identified as critical to ensuring their effectiveness. Number 1, hold regularly scheduled meetings with key leaders who have the authority to encourage participation, provide requisite resources, and ensure that agreed upon goals and tasks are accomplished. Number 2, respect and honor the experiences of stakeholders who are included in the guiding body, especially system-involved youth and families whose experiences have been proven to be very beneficial to improving practices, systems, and policies that affect them. Create an environment that enables all stakeholders, especially system-involved youth and families, to speak their truth without provoking additional traumas, requires additional thoughtful consideration and excellent facilitation skills. Number 3, provide leadership training and coaching that helps all stakeholders translate their personal experiences and perspectives into constructive recommendations for improving practices, systems, and policies, as opposed to advocating for personal agendas. And number 4, eliminate barriers to participation, including location, language access, childcare, and food, in order to facilitate greater participation and consistency. Paying attention to the logistics that make it possible for these stakeholders to fully participate is critical. Phase 3 of the process focuses primarily on communication. In this phase, you will create and execute an outreach plan, conduct engagement with identified stakeholders, allow maximum opportunities for participation, which includes careful preparation for the facilitation of the meeting or call. You'll state clear next steps and follow-up, debrief with the guiding body, and document the process. Here are just a few things to keep in mind as you design your meetings. Results. What do you want to accomplish? What will have happened by the end of the meeting? Relationships. How do the participants relate to the facilitator, to the agency, to each other, and to the result? How can you foster trust among the group? Process. How can the design of the meeting help you to achieve your desired results? Resources. What are the participants bringing with them that will help get the results you want, such as their time, their commitment, their passion, their talent, who they know, who they can influence, and access to others? Follow-up is an often missed but critical component of meetings. Some questions that you should be able to answer include: what were the action items that came out of the meeting? How would you follow up with stakeholders to show that the action items were completed? How will you implement the helpful feedback and input that you received? How will you communicate that you used the feedback and input back to your stakeholders? What is the time period that you want to communicate back to the stakeholders within? Is there any follow-up communication that needs to happen after that date? What aspects of the meeting preparation and proceedings can be improved upon? Like we've already mentioned, be sure to document this part of the process. Phase 4 is synthesize and strategize. Basically, this is the data-heavy part of the process. In this phase, we include stakeholders in analyzing and synthesizing the data. We share user-friendly findings, identify priorities, and develop strategies through co-design processes. We engage the guiding body and dedicate resources. And we ensure everyone knows how and agrees to how the decisions are going to be made. Now let's go back through and discuss this in a little more detail before we move on. Presentation of user-friendly data. When preparing to engage stakeholders in the interpretation and analysis of their input, It is important to present information in a clear, user-friendly way. When appropriate, charts, graphs, and other visualizations should be used to increase the ability of stakeholders to understand relationships among the data. The more stakeholders understand the data, the more they can contribute and make recommendations to achieve desired results. Set aside appropriate resources. Through engaging stakeholders themselves and analyzing the input from the processes strengthens the legitimacy of the planning and strategy development process. It is not without cost. Preparation for engaging stakeholders in discussions, developing communication tools, completing preliminary data analysis, and conducting meetings takes time that should be included in workload and resource estimates. These meetings can also be quite intense, requiring skilled facilitation. Depending on how much information there is to present, it may be preferable to split a complex analysis session across 2 days. For example, a day to review findings and a second day to firm up recommendations. Choose the right participants. Part of the art of conducting participatory analysis of stakeholder input is deciding who will be at the table. Rather than seeking to re-engage every stakeholder who contributed his or her thoughts and opinions during your outreach efforts, it may be preferable to work with a smaller, representative subcommittee or work group. Including stakeholders who are in action or decision-making positions is not only critical to developing actions, but also informing others of findings and results. Reasonable expectations. Participatory analysis helps to increase stakeholder understanding about what conclusions could realistically be drawn from their input and other available data, which aids in the establishment of reasonable shared expectations about the feasibility of proposed strategies. Including stakeholders in the analysis phase also reinforces how important their perspective is, vital to understanding the data and developing strong recommendations. Stakeholder support. Including stakeholders in synthesis and analysis processes further demonstrates that their perspective is vital to understanding the data. It also helps to foster increased stakeholder support for resulting interpretations and findings. As you can see, data helps us to make informed decisions. Data-driven decision-making is the coordinated collection, analysis, and dissemination of key outcome measures that illustrate what is working well and what needs to be improved. And here we have just a few steps for data-driven decision-making. Share and explain data and available information. Statement of options as equal. Exchange of information on pros and cons of options. Exploration of understanding and expectations. Identifying preferences. Negotiating options and concordance. Sharing the decision. And arranging follow-up to evaluate decision-making outcomes. Phase 5 is reflect and affirm. Think of this phase as the review phase. Here, stakeholders review the proposed strategies. We engage in and conduct reflective discussion and, of course, document the process. Once everything has been reviewed, we move to phase 6, finalizing the strategy. This is really just putting the finishing touches on things. You'll articulate a final strategy, engage stakeholders in implementing proposed strategies, and document the process. And of course, once everything is finalized, you will adopt and launch your strategy, which is phase 7. Here, you'll communicate strategy to the stakeholders, implement the strategy, engage the guiding body, and document the process. But you're not done yet. Just like follow-up should be done after meetings, phase 8 is evaluate and improve what you have implemented. What evidence or indicators will be used to measure stakeholder engagement? What about of the successes of the project or initiative? We'll engage the guiding body and stakeholders in evaluation design and involve the stakeholders early. Evaluate the results, processes, and participant satisfaction, and document the process. By now, you've likely noticed that each phase of the process requires documentation. But why? Well, documentation allows us to learn from past stakeholder engagement experiences and to continue to improve performance. Additionally, documentation is a protective feature for everyone involved in the decision-making process. Remember, if it's not documented, it didn't happen. Next, we will be covering barriers to shared power in collaborative decision-making and community planning. Take some time to consider barriers to shared power in the community planning process. What barriers have you experienced or expect you will experience during the community program planning process? Here are some of the things that might have come to mind, such as capacity and ability to participate, hard to reach groups, community infrastructure, contested or divided communities, rural isolation, gaps in information, literacy, and stigma. Now let's discuss this in more detail. Capacity and ability to participate includes lack of transportation, lack of childcare, illness and disability, and other commitments such as lack of available time. Hard to reach groups. This can include lack of technology, lack of exposure, distrust of the outside the immediate community, and the social structure. Barriers within community infrastructure include crime, lack of health and community services, lack of advocacy, poor economy, and unsafe and hazardous environments. Micro-communities are communities within a given community, no different than you have multiple blocks within your neighborhood. Relational identity refers to how a person defines themselves within the context of a given role relationship. Rural isolation includes barriers such as lack of transportation, lack of service providers, lack of representation, and lack of privacy. Gaps in information barriers include a complete lack of information, hard to find information, incomplete information, and inaccurate information. Literacy and numeracy barriers include illiteracy, innumeracy, and language barriers, such as speaking a language from another country. Stigma barriers include mentalism, which is discrimination based on a mental trait or condition, macroaggressions, which are obvious and easily identified by all who witness it as unfair, biased, and discriminatory, microaggressions, which are more subtle and not as obvious, so they can be harder to point out or confront, low expectations, myths about peer support that keep peers trapped in subordinate, low-level positions and prevent them from fully contributing and reaching maximum potential. This can create feelings of hostility from others who feel that peers get a free pass, and it can also reinforce stereotypes of peers. There's also marginalization, which it means to place in a position of marginal or minor or diminished importance, influence, or power. And finally, tokenism, which is the practice or policy of making no more than a minimal or symbolic superficial effort to offer opportunities to minorities equal to those of the majority. It's also known as box checking. Stakeholders are not the only people to experience barriers to shared power and collaborative decision making. Some barriers for agencies include ongoing commitment, different community needs, lack of stakeholder involvement, communities that feel marginalized, and a lack of resources and capacity. Ongoing commitment could be internal or external. Internal refers to responsibilities and obligations within the agency, while external refers to responsibilities and obligations outside of the agency, such as in the home, a place of worship, school, or other things outside of the agency. There could also be different community needs. Diverse communities have a variety of needs, which can be conflicting and sometimes difficult to prioritize. They may also have limited resources coupled with diverse needs, which could mean choosing between either equally yet inadequately spreading the resources amongst all the needs, or fully providing for the needs of some parts of the community while ignoring or inadequately providing for others. Lack of stakeholder involvement could be due to ineffective marketing, space created might not be welcoming, and airtime might not properly be monitored or facilitated. Another barrier is that communities could feel marginalized. This could be due to past or expected tokenism. People could be frustrated with a broken system and hurt by lack of authenticity. And finally, there could be lack of resources and capacity. This includes budget constraints, being short staffed, or lacking appropriate training. Now that we understand how to implement collaborative decision making and some potential barriers to watch out for, let's talk about some of the potential outcomes of this process. When implemented correctly, there are multiple benefits for stakeholders, including greater opportunities to contribute directly to policy and program improvements, the ability to have their issues heard, an opportunity to participate in the decision making process, more open and transparent lines of communication, and increased accountability of agencies to honor their commitments. Further benefits include early identification of connections between stakeholder interests and agency work, encouraging collaborative and comprehensive solutions to address complex goals and challenges, increased understanding of agency goals, service delivery standards, and parameters, in other words, reasonable expectations, and the ability to positively improve conditions for children and families in their community. Likewise, there are many benefits for agencies, including improved communication between agencies and other individuals, groups, and organizations that they work with, access to critical information on the experiences of communities and families and others involved in the system, the ability to consider the implications of policy initiatives or proposals to inform strategy development, and ensuring services are delivered in collaboration with stakeholders and demonstrate outcomes to address community needs. Other benefits for agencies include improved relationships with a wider network of support for families, greater cooperation, collaboration, and mutual support among internal and external stakeholders, improved risk management practice, allowing risk and implications to be identified and considered earlier, streamlined policy and programmed processes, enhanced community confidence in agencies, and enhanced capacity to promote innovation and sustain programs. Unfortunately, when poorly executed, There may be potential consequences, such as undermine potential to successfully achieve project goals, create mistrust, waste stakeholders' time, waste the employees' time, engagement fatigue, you could lose credibility, increase questions and uncertainty, and even lose funding. Engagement fatigue refers to the reluctance to participate in future activities. So, what are the future goals for shared power and collaborative decision making? Future goals include increased community engagement, implementation of shared decision making, document, adapt processes based on lessons learned, and share findings with other agencies. That concludes our training on shared power and collaborative decision making in the community program planning process. Today, we covered the Mental Health Services Act and Stakeholder Bill of Rights, what shared power and collaborative decision making is, guidelines for collaborative decision making, barriers to collaborative decision making in community planning, and outcomes of collaborative decision making in community planning. Thank you for attending this presentation. Please reach out to us anytime over the web, by email, phone, or social media.